I am Dr. Daniel Paull. I'm an orthopedic surgeon here out in Colorado, and I've been asked the question, how do I know if I tore my meniscus? And if I did, is that bad? Well, if you're watching this video, it probably means that you're having knee pain. So, you know, to know if you tore the meniscus, it's first good to know what exactly the meniscus is or what they are. So you've got two in each knee. They're kind of like shock absorbers for your knee. One's shaped more like a C, and one's shaped more like an O. They used to think that they didn't do anything, and way back when they would just take them out in their entirety. They found that that led to a lot of early arthritis. So the way someone tears their meniscus is usually a sort of twisting motion that they do to their knee. Maybe, you're running or you take a misstep, or if you're getting up from a chair, anything where your knee's twisted. Now, what also puts more extra pressure on the meniscus and leads to tears when your knee's bent more than 90 degrees. So if you have an activity where your knee's bent more than 90 degrees and you have a lot of pressure on it and your knee's twisted, that could be when you tear the meniscus. So what exactly does that mean? Well, picture you've got these two discs inside your knee, and now you've torn part of it. Well, anytime your knee bends or extends and flexes, sometimes that tear kind of catches in the knee, and that can hurt and cause a lot of pain. And that's what people say, like, oh, I got a meniscal tear, and that's usually where the pain comes from. Now, there are a lot of people out there that do have tears in their meniscus, and they don't necessarily have pain, especially in the older population. A lot of them will have a tear of the posterior horn of the medial meniscus, and they'll get an MRI and they say, well, you have a meniscus tear here, but that's not really the source of their pain. But it depends on where exactly it is. Now, if the tear is stable, meaning it's not catching in the knee so much, it's not always super painful. But if it is catching, that's more of an unstable tear, and that's one that'll hurt a lot. So the symptoms are you have knee pain, you'll have some swelling of the knee if you just tore it right away, and sometimes you'll even have some clicking or catching. In extreme cases, if the tear is really bad, sometimes it can block you from straightening your knee out entirely. So if you have those symptoms, you might have a tear. Now, how do you know if you have a tear? Well, one of them is getting a good physical exam. It's something that's hard to do on yourself, and the best thing to do is go to an orthopedic doc or another doc or someone who's trained in that orthopedic meniscal exam, and they can tell you with pretty good probability whether you've torn it or not. And if there's any concern or it's still bothering you, then an MRI will tell you for sure. But be careful about MRIs, because sometimes they'll show things that are not the cause of your symptoms. So yes, you may have a meniscal tear, maybe you don't, it finds other things. So MRIs can be a double-edged sword. So once you have one, let's say you do have one, what happens? What do you do? Well, sometimes the pain goes away on its own. If it's not so bad, sometimes you can wait it out, ice, elevate your knee. Sometimes a short course of physical therapy will help get the muscle strong and get your knee going again. And if you're older, this can be a good solution for you. And if the knee's not hurting so bad and you have a tear in there, who cares? It's not like you have a clogged artery in your heart that you're going to die from. I mean, it's just in your knee. If it doesn't hurt, leave it alone. Even if they find one on MRI, just leave it alone. Now, if that doesn't help so much, some people will try steroid injections, plus or minus to whether that works. If the pain's really bad and you've tried therapy and you've been to the doctor, then at that point you may need a surgery arthroscopically, meaning they make two small poke holes and they'll just trim away the torn part. So you say, well, can't they repair it? The thing with the meniscus is the blood supply is not good. So unless it's torn in a very specific part, it doesn't heal. So the doc can suture it back together, but it doesn't mean it'll heal. So in most people, it's like a piece of paper that you torn, you're just cutting out the part that's torn. And that usually provides pretty good relief. That being said, if you have an arthritic knee already, is a meniscal surgery going to help you that much? It's hard to say. But the first step that you always need is to get an accurate diagnosis. You need to confirm that you have this tear. Once you have that, then you can move forward into seeing what you want to do for it. I've torn my meniscus myself. I've had surgery on it before. It helped me out. Doesn't mean everybody needs surgery. But just make sure you do due diligence and, to see what you have and, what your options are. I hope this video was helpful. If you have any questions, feel free to comment, and I'll do my best to respond.